customer service experience, especially for the customer service rep, was getting more and more complicated over time. So in order to keep up with that, in order to be able to make the experience a pleasant experience for the member on the other end of the phone, we needed to kind of focus on the customer service, the tools they had, in order to make it a better experience. So that was the genesis of this, was really trying to make sure that the member experience was an excellent experience.
One of the initiatives was a focus on improving member experience, and we called it Member Experience Excellence. And out of that group came a number of initiatives, the member dashboard being one of them. The vision was always to have the answers at their fingertips when they needed them, so that they could focus on helping that member and not hunting around to try and find the information that they need. Healthcare has become so complex that the job of a consumer advisor is not just to answer questions that's asked of them, but to truly help educate that member on the healthcare system.
One of the things we were looking at is how much do you leverage the core investments we already have in some of the core products like Care Advance and Facets, and then what can you do to kind of expose that data in the best way to make the experience good. So really it was an effort of optimizing the investment but getting the best experience out of that.
When we put the dashboard in place, we did see a decrease in average handle time for our calls, and we saw an increase in first call resolution. That contributed along with some other initiatives that we were doing at the time, but really focusing on that member experience and removing the barriers for our consumer advisors so that they could ensure that that member experience was as positive as it could be.
The guidance was let's try to answer 80% of the questions through a consolidated dashboard, enabling the customer service rep not to navigate so much and focus more on the conversation that was at hand with the customer.
It is a win-win for the consumer advisor and the member, because the consumer advisor is focused on that member's needs and doing the adult education that's needed to help them navigate the system, rather than spending time on trying to find the right answers within the multiple systems that we were exposing them to.
So one of the things that we depend on TriZetto for is to be a core partner vendor, but it's truly a partnership where they are understanding what's going on in healthcare, staying up on the industry, and understanding their customer, which in this case is a payer community, understanding our needs in order that we can fulfill the end customer needs. TriZetto, that's an important role that they have, is keeping up with the industry, and they're doing a great job as illustrated through healthcare reform and a lot of other initiatives.